Having a stroke can be life-changing, and it can affect people in different ways. Adjusting to these changes will take time. You, your family, and friends may now be adjusting to new roles, routines, and certain parts of life that may have been put on hold. It's normal to feel grief, frustration, anger, and sadness on your journey in getting back to life. Everyone deals with having a stroke in different ways. Talking with members of your healthcare team, talking with other stroke survivors, or joining a social, recreation, or exercise program can help with the recovery process. Each person plays many roles in life. For example, you may be a family member, a friend, or a coworker. It's normal to wonder if you will be able to fulfill these roles again and return to your regular activities. Over time, daily routines and life roles will change to suit your strengths and abilities. You will find new strategies and other ways to help you adjust to these roles. Stroke can also change how you feel about your body, which may affect sexual feelings. You may be returning to sexual activity or finding new ways to express sexual feelings and intimacy. You may not be ready to explore sexual activity right now. It takes time to adjust, and feelings can gradually return. You may simply enjoy being close to your partner and can be intimate with touching, kissing, and hugging. Share your feelings and keep open communication with your partner and healthcare provider like your doctor or social worker to overcome these challenges. It's common after a stroke that you might be more emotional, anger more quickly, or show emotions that do not match the situation, like crying when you aren't sad. These emotions may be hard to control and change quickly, but should happen less as your brain recovers. It may be helpful to let others know that your emotions do not match how you're feeling. They can also help you by finding a distraction or talking things through. If these changes in emotions are getting in the way of your life, talk with your doctor to see what help is available. Depression and anxiety can occur in up to 1/2 of people who have had a stroke. It can be caused by changes in the brain after a stroke, or maybe a reaction to changes in your life. Look for any changes to your appetite or sleep. Have you lost interest in things or activities that you used to enjoy? These can all be signs of depression. Sometimes others notice these changes before we do. If depression leads to thoughts of suicide, call your doctor, a helpline, or 911 right away. Depression can be treated. Treatment takes on many forms, which can include counseling or medication. It can be hard to talk about feelings, but it can help with your recovery. Remember, feeling depressed after a stroke is not a sign of weakness, but one more way that you can be affected after a stroke. Family and friends often become caregivers to provide help to someone. Caregivers may have to take on new roles and responsibilities. The caregiving role can be rewarding, but you may have feelings of guilt, anxiety, stress, or frustration about this new role. All of these feelings are normal. Change takes time. Caregivers can put so much focus on the person who had the stroke that they forget to take care of themselves. Caregivers may feel overwhelmed, have difficulty making decisions, or notice other physical and emotional changes. As a caregiver, it's important to notice when you're feeling burnt out or depressed. Ask for support from your doctor, a friend, or a member of the healthcare team. Sometimes people will join a support group for caregivers to speak with others who have had similar experiences. Take time to focus on your needs. This could mean getting a massage, meeting with a friend, or even running an errand of your own. Whether you have had a stroke or are a caregiver of a person that has had a stroke, there is help out there and you are not alone. Share your feelings and keep open communication with your partner, family, or other supports. Join a peer support group, share strategies, and learn from each other. Participate in a social, recreational, or exercise program in your community, and remember to work with your doctor, social worker, and healthcare team to help you with your emotional recovery. Be sure to check out the next video in the series, Function for Daily Living.